Hello everyone, welcome back to my YouTube channel Speedy Dentistry. Today we'll be learning about the guidelines for use of antibiotics, which were given by Burke at Miles et al. In their experimental observation, and they gave out 12 guidelines which we'll be studying in pairs. First one is start with the empirical therapy, and second is identify the organism, which is done with the help of culture and sensitivity test. And this is done in cases where host defense has been compromised, in patients with persistent or post-operative infections, and in patients in which we are suspecting either actinomycosis or osteomyelitis. Coming to the third one, try to use specific narrow spectrum antibiotics rather than starting with broad spectrum antibiotics straight away, so that we can prevent the resistance for the antibiotic and we can prevent the super infection. Coming to the fourth guideline, reserve the combination therapy for cases like sepsis of unknown origin, specific organism is overgrown and we require bactericidal action in a greater amount. So for that we reserve combination therapy for patients with tuberculosis and for patients with specific or space infections. Fourth is proven history of success. Use antibiotics with proven history of success and which are least toxic. Next, seventh is use bactericidal drugs rather than bacteriostatic. Cidal stands for drugs or antibiotics which are capable of killing rather than the antibiotics which only stop the growth. So we prefer cidal than static. Eighth is proper administration should be monitored. That is dose, route and time should be proper of administration of antibiotics. Ninth one is definitely the cost should be low and number of pills should be low as possible so that the patient compliance increases. 11th one is monitor the antibiotic coverage, and 12th is cause of failure should be identified. For this, you should be capable of identifying why your antibiotic coverage is not being effective. So it could be due to inadequate surgical intervention required. So it could be possibly you have not removed the source of infection or pus, or you have not removed the foreign body. Also, cause of failure can be other sources of infection like IV catheter or Foley's catheter. Reduced or compromised host defense can also be a cause for the failure of antibiotic coverage. Mistaken administration of drug, that is you have administered a IV drug required and you have administered through the IM route. And wrong culture reports, that is you have mistaken with other patient reports or you have mistaken the resistant and sensitive antibiotics. So that could be cause of failure. So to summarize, Burke and Miles gave the experimental observation through which they gave the antibiotic guidelines. First was empirical therapy should be started, and when you have started, try to identify the organism through culture and sensitivity. Second pair was use specific narrow spectrum antibiotics and try to reserve the combination therapy. Fifth one was use antibiotics which are having proven history of success. And sixth one, least toxic antibiotics should be started. Next pair was prefer cidal drugs rather than static. and proper administration of drug should be there. Cost should be as low as possible, and also try to reduce the number of pills so that the patient compliance is increased. 11th one is monitoring of patient should be done, and if you have failed, try to find the cause of failure of antibiotic coverage. Thank you for patient listening. Stay tuned for more.